Hi, I'm Dr. Mary. Today, we're diving deep into one of the most critical and exciting milestones of your pregnancy. Week 28, with this comprehensive 8-minute guide. Congratulations! You've officially reached the midpoint of your third trimester. This is the home stretch where physical and emotional preparations really pick up speed. The third trimester is the most vital phase as your baby gains weight rapidly and puts the finishing touches on getting ready for the outside world. Let's start with a question that confuses many moms-to-be. How many months is 28 weeks exactly? Let's clear up this confusion once and for all. In medical terms, week 28 marks the beginning of your 7th month. You've officially entered the final third of your pregnancy, the final stage. So, how long until the big meet? If everything stays on track, you have just 12 weeks, about 84 days, until you finally hold your baby in your arms. You won't believe how fast time flies from here. Focus on enjoying every moment and staying on top of your final preparations. Now, let's take a closer look at the miraculous developments your little one is making this week. Are you ready? The adventure continues. Your baby is now about the size of a large eggplant. They've grown quite a bit and are starting to fill up the space inside much more. Your baby's weight has finally crossed that critical 1 kilogram threshold, reaching about 1,100 grams. They're getting heavier every single day. From head to heel, they're now about 38 centimeters long. You're getting closer to that real-life baby size you'll soon feel in your arms. Starting this week, your baby begins storing fat rapidly. These fats are vital for maintaining their body temperature after birth. The biggest miracle this week is happening in the brain. Brain tissue is becoming much more folded and complex in its structure. Brain waves now show a regular rhythm. This means your baby's sleep and wake cycles are beginning to take shape. In fact, research shows that babies enter REM sleep during these weeks, meaning they might have already started dreaming. What are they dreaming about? Your baby can now open and close their eyes. They might even notice a strong light from outside your belly and react to it. The lungs are also at a critical stage. They've started producing surfactant, a substance that prevents the air sacs from sticking together. This is very important because thanks to modern medicine, babies born at 28 weeks now have a over 90% chance of survival. This is a great source of comfort. Another major development: your baby's bone marrow is now taking over the role of producing blood cells entirely from the liver. Don't be surprised if you feel regular rhythmic jumps in your belly. These are usually just harmless little hiccups. But what about your body? As the baby grows fast, you might feel the physical load more. Let's talk about solutions to keep you comfortable. Leg cramps that wake you up at night are one of the most common complaints this term. The cause is often a mineral deficiency. Light calf stretches before bed and staying well hydrated throughout the day will significantly reduce these cramps. It's worth a try. As your uterus presses against your stomach, heartburn and indigestion can return. This happens when stomach acid escapes into the esophagus. Divide your meals into 6 small portions and try not to lie down immediately after eating. This simple rule will make your life much easier. Since your center of gravity is shifting forward, back and waist pain can increase. Pay attention to standing straight to reduce the load on your spine. Supportive orthopedic shoes and pregnancy pillows placed between your legs while sleeping are your greatest allies in relieving pain. Some moms-to-be experience an uncontrollable urge to move their legs, known as restless leg syndrome. This can be quite frustrating. This condition is often linked to iron deficiency. If you have a persistent restlessness in your legs, be sure to have your iron levels checked. Don't be alarmed if your belly suddenly tightens from time to time. These are Braxton Hicks contractions, your uterus practicing for birth. They're harmless. Give extra importance to iron in your diet. Your body needs more iron as your blood volume increases. This is also critical for postpartum recovery. Don't neglect calcium to strengthen your baby's bones. Besides dairy, almonds and broccoli are also great sources. Try to include them daily. Omega-3 is a must for your baby's brain development. Aim for fresh fish twice a week or use fish oil supplements if recommended by your doctor. It might sound surprising, but the best way to flush out edema is to drink more water. Aim for at least 3 liters of water a day. It's now time to start tracking baby movements. This is the simplest and most effective way to know your baby is happy and healthy inside. Every day at about the same time, make sure you feel at least 10 movements within 2 hours. They're usually more active after meals. What used to feel like butterfly flutters are now becoming real kicks or elbow jabs. Sometimes they might even catch you off guard. As your skin stretches, it can cause itching and stretch marks. Keeping your skin hydrated with natural oils and lotions will help reduce their depth. Always prefer the left side for your sleep position. This reduces pressure on major veins, keeping the flow of blood and oxygen to your baby at its peak. As birth approaches, your anxiety might increase. This is totally normal. Meditation, breathing exercises, or a chat with a friend can really help. If you haven't already, this is the perfect time to start nursery preparations. Get the heavy lifting out of the way while you still have the energy. You can also start planning your hospital bag slowly. Start by listing the most basic essentials for yourself and the baby. A note for partners too. At this stage, a little foot massage or help with chores is the greatest support you can offer her. After week 28, your doctor visits might become more frequent. Discuss your glucose screening results and overall health in detail with your doctor. If you and your partner have Rh incompatibility, your doctor might recommend a protective shot, anti-D immunoglobulin, around these weeks. Don't miss it. Know the signs of preterm birth: severe back pain, water breaking, vaginal bleeding, or regular contractions. If any occur, call your doctor immediately. Don't forget to talk to your baby. They recognize your voice now. Reading or singing to them will strengthen your bond even before birth. Your feet might swell by the end of the day. Elevating them with pillows above heart level while resting will help reduce the swelling. A common question: can I still fly? Most airlines require a doctor's note after 28 weeks. Always consult your doctor before making travel plans. Is exercise safe? As long as you avoid heavy lifting, walking, swimming, and prenatal yoga can ease your labor and improve your mood. Next week, your baby's bones will harden further and their immune system will strengthen. Don't miss that video as our journey continues. To recap, stay hydrated, watch your nutrition, count those kicks, sleep on your left side, and most importantly, stay positive throughout. You're doing an amazing job. Every moment of this journey is worth it for that first second you hold them. Take great care of yourself and your little one. Once again, this information is for educational purposes. Always consult your healthcare provider for any medical concerns or conditions. I'm Dr. Mary. I'll see you in our next development guide. For now, goodbye, stay healthy, and enjoy this beautiful process.